Noticing your furry friend seems maybe a little thinner than usual.
Yeah,
It's one of those things, isn't it? Subtle sometimes, easy to miss, but, well, when you see it, it definitely triggers that little worry.
absolutely. It's a symptom that doesn't spell out exactly what's wrong, but it's definitely a red flag. Your veterinarian takes it very seriously. It always needs a closer look.
And that's exactly what we're diving into today. We've gathered a whole bunch of expert veterinary research, clinical insights, all about weight loss in our pets.
Yeah, our goal here is to really walk you through this. We want to understand what, significant weight loss actually means, how to spot when it might be something more serious called cachexia.
Cachexia, right?
Look into the many reasons it can happen, how vets do their detective work to figure out the why,
Mm-hmm.
and then talk about the strategies for treatment and, supporting the pet.
So think of this as getting the key info from top veterinary sources, that kind of boiled down so you feel a bit more prepared if you ever encounter this.
Exactly. And we're covering insights relevant to both dogs and cats here.
Okay, let's unpack this then. We talk about a pet losing weight. What does that actually mean, clinically speaking? Is, like, any weight loss a big deal?
Well, at its core, it's just unintended body weight loss. But clinically, vets really start paying close attention when it becomes significant.
Significant meaning.
We're talking maybe a sudden acute loss of around 10% of their normal stable body weight,
Hmm.
or maybe a more gradual chronic loss that reaches about 15%. That's the point where it shifts from, maybe needing a food adjustment to needing a proper investigation.
Got it. So there's lost a pound or two, and then there's clinically important weight loss. Okay, but you mentioned another term, cachexia. That sounds, well, much more serious. How's that different?
Yes. This is a really critical distinction. Cachexia isn't just weight loss, it's a state of severe wasting.
Hmm.
The huge difference is the significant loss of lean body mass, mostly muscle on top of fat loss. Simple weight loss might just be losing fat reserves. But cachexia, that's driven by an underlying chronic disease. Think advanced cancer, severe heart failure, major inflammatory conditions. It's definitely not just simple starvation.
Ah, okay. So simple weight loss is like the body shrinking, but cachexia is the body actively breaking down its own tissues because of an illness.
You got it. And closely related is another term, sarcopenia, that's specifically about losing muscle mass, sometimes disproportionately.
Sarcopenia.
Yeah, and what's interesting there is sarcopenia can happen even if the pet's overall weight doesn't drop much, especially if they were overweight to begin with. It can be linked to disease or sometimes just part of the aging process.
So why is losing that muscle, that lean body mass, why is that such a big problem? What makes cachexia or sarcopenia so much more worrying than just losing fat?
That's a really important point. Losing muscle mass leads directly to debility,
Hmm.
weakness, fatigue,
Hmm.
even trouble breathing because the respiratory muscles get weaker. For both dogs and cats, significant loss of lean body mass is a major risk factor for mortality. Pets that are underweight or actively losing muscle when they have chronic diseases, like heart problems or cancer, well, they actually tend to have shorter survival times. It's not just a side effect. It actively makes things worse.
So it's not just a symptom of the illness, it's actually helping the illness, making them weaker, contributing to their decline.
Precisely. That's why identifying it is so crucial.
Okay. So we know what we're talking about. Let's get into the why. Simple weight loss and this more complex cachexia. What's behind simple weight loss?
Simple weight loss, fundamentally, it comes down to a negative energy balance.
Hmm.
It's basically an equation, right? Calories going in are less than calories being used or lost.
So it could be a problem with getting food in the first place.
Exactly. Decreased intake. Maybe the pet just has a poor appetite because they feel unwell, generally.
Mhm.
Could be painful teeth-making, chewing difficult.
Yeah.
Or, sometimes in homes with multiple pets, one just doesn't get fair access to the food bowl. Trouble swallowing or vomiting and regurgitation.
Yeah.
Those obviously stop nutrients from being absorbed too.
Or is it the other side of the equation, using up or losing calories too fast?
Yes, increased expenditure or loss. Some conditions really ramp up metabolism. Hyperthyroidism is a classic example, super common in older cats.
Right.
Or just having a fever burns more calories. And then nutrients can be lost through ongoing vomiting or diarrhea,
Oh.
or in diseases like uncontrolled diabetes where glucose spills into the urine,
Oh, okay.
or certain kidney or gut diseases that actually cause protein to leak out of the body.
But the sources mention that with simple starvation, the body tries to cope, doesn't it? It adapts.
It does, yes. If an otherwise healthy animal simply isn't getting enough food, the body tries to conserve energy. It'll slow down its metabolic rate a bit, shift towards burning fat for fuel, trying to spare that vital muscle protein for as long as possible.
Okay, now, cachexia. You stressed how different it is from simple starvation. What's actually happening metabolically that makes it so distinct and, well, so much harder to fix?
All right, cachexia isn't just about not enough calories in. It's a really complex metabolic syndrome. It's triggered by those underlying chronic diseases we mentioned: advanced cancer, kidney failure, heart failure, severe ongoing inflammation. These diseases create this state of systemic inflammation throughout the body.
And that inflammation, what does it do?
It fundamentally messes with how the body uses energy and handles nutrients. The sources highlight a few key things. You get activation of these inflammatory signals. They're called cytokines, like distress flares going off everywhere. There's also activation of systems that are designed to break down protein, particularly muscle protein. And here's the kicker. Metabolism often actually increases. The body starts burning through calories faster.
Wait, hang on. So even though they're wasting away, their body is running hotter, burning energy faster. That seems completely backward.
It is counterintuitive.
Yeah.
And that's why understanding cachexia is so critical.
Right.
This inflammation also interferes with appetite signals,
Mm-hmm.
makes the body resistant to insulin sometimes, making it harder to use nutrients properly. It creates this vicious cycle.
A vicious cycle.
How? Well, the inflammation causes appetite loss, and it actively drives muscle breakdown, and it speeds up energy use, all while making it harder for the body to actually build tissues back up.
And that explains why just pouring more food into them doesn't fix cachexia. You're fighting this underlying metabolic chaos.
Exactly that. A huge takeaway is that simply increasing calories without tackling the root disease and these metabolic shifts, it rarely works to reverse cachexia and stop that tissue wasting.
That's such a crucial difference. Wow. Okay, the sources give these broad categories for causes, which must help vets organize their thinking. Things like diet issues, not eating or pretending not to eat because of pain.
Right, pseudoanorexia.
Problems digesting or absorbing food, metabolic or hormone disorders, cancer, infections. Lots of possibilities.
That structure is absolutely key for a vet. It gives them a framework, a checklist almost, when they're faced with a pet losing weight.
Let's pull out a couple of specific examples that might be, I don't know, surprising or particularly interesting. Exocrine pancreatic insufficiency EPI.
Oh, EPI is a classic. A really good example of weight loss with a twist. Basically, the pancreas stops making the enzymes needed to digest food properly.
So
The animal eats and eats. Sometimes they have a truly ravenous appetite, but because they can't break down and absorb the nutrients, they just waste away. Dramatic weight loss. We see it quite a bit in certain breeds, like German Shepherds.
wow, eating like crazy but fading away. That's a sign you definitely notice. What about hyperthyroidism in cats? You mentioned that.
Another really common one, especially in older kitties, the thyroid gland goes into overdrive, floods the system with thyroid hormone, and sends their metabolism through the roof. So these cats often lose a lot of weight, but again, frequently their appetite is normal or even increased.
And cancer cachexia. That sounds incredibly tough.
It really is. Cancer is unfortunately a leading cause of severe cachexia. The tumor itself, plus the body's inflammatory reaction to it. It just profoundly impacts metabolism. Leads to that significant muscle and fat loss we talked about.
And it happens with advanced heart failure, too. Cardiac cachexia.
Yes, that's a recognized complication in severe heart disease. Similar inflammatory and metabolic things are going on, often made worse by poor nutrient absorption because of, gut congestion from the bad circulation.
Okay. So if an owner sees their pet losing weight, what's the process? How does a vet start figuring out which of these many potential causes is the real culprit?
It always starts with a methodical investigation. Like any good detective work, really.
Gathering the clues first, I imagine.
Exactly. Taking a really thorough history from the owner is step one. The vet needs to know everything about the diet, what food, how much, any recent changes. Are there other pets? Could there be competition for food?
Mm-hmm.
When did the weight loss start? Was it sudden, gradual, and critically appetite? Is it down, normal, or actually increased? Then all the other signs: vomiting, diarrhea, drinking more, peeing more, coughing, limping, any behavior changes, even recent travel history or medications they're on. It's all potential evidence.
Then comes the hands-on part, the physical exam. What are they looking for besides just the number on the scale?
Oh, the scale is just the beginning. The vet assesses body condition score, BCS, usually on that 1 to 9 scale that estimates body fat.
Oh.
But just as vital is the muscle condition score, or MCS.
MCS, okay.
This is assessed separately from fat. The vet actually feels the muscles over specific bony landmarks, the shoulder blades, the skull, the hips, the big muscles in the thighs.
So they're literally feeling for muscle shrinkage.
Exactly. It helps tell apart simple fat loss from that more worrying muscle wasting you see in sarcopenia or cachexia, even if the pet still has some fat covering. The rest of the exam is a head-to-tail check for clues. Looking in the mouth, feeling the belly for lumps or pain, listening to the heart and lungs, checking lymph nodes, feeling the thyroid area in cats, checking hydration. The works.
And after the history and physical comes the initial testing, right? The baseline diagnostics.
Usually, yes. The standard starting point is what we call a minimum database. A complete blood count, CBC, a blood chemistry panel, and a urinalysis. These are broad screening tests.
And what sort of clues can those initial tests give?
Oh, lots potentially. The CBC might show anemia, low red blood cells, suggesting chronic bleeding or maybe kidney disease. The chemistry panel looks at organ function, kidneys. Liver checks blood sugar for diabetes, looks at electrolytes, protein levels. Low protein can point to loss through the gut or kidneys, or just severe cachexia itself.
And the urinalysis.
That gives crucial info on kidney function, like how concentrated the urine is. It can also detect infection, protein loss, or glucose spilling into the urine, which points towards diabetes.
And checking stool samples, too.
Definitely important. Need to rule out worms or other parasites like Giardia. They're common causes of weight loss, especially in younger animals or those with exposure.
Are there specific tests run early on for really common culprits?
Yes, absolutely. In cats, testing for feline leukemia virus and feline immunodeficiency virus, FALV and FIV, is pretty standard. And checking thyroid hormone levels, the T4 test, is essential for any older cat with unexplained weight loss. It's just so common.
Okay, so let's say those initial tests don't give a clear answer or they point in a certain direction. What's next in the diagnostic toolkit?
Well, based on those initial findings, the vet will move to more targeted, advanced tests. Imaging is often really key here. X-rays of the chest or abdomen can reveal tumors, fluid, changes in organ size.
And you mentioned ultrasound earlier.
Abdominal ultrasound is hugely valuable. It gets such a detailed, real-time view inside. You can see masses, changes in the gut wall that might suggest inflammatory bowel disease or lymphoma, and it's fantastic for guiding needles to get biopsy samples safely. If heart disease is suspected, then an echocardiogram and ultrasound of the heart is the way to go.
What about more specific blood or urine tests?
Yeah, those are chosen based on suspicion. For instance, there's a specific blood test, TLI, to confirm EPI, that pancreatic issue. Other tests can check for Addison's disease, evaluate liver function more deeply with bile acids tests, quantify protein loss via the kidneys using a urine protein-creatinine ratio, or check for vitamin deficiencies like B12 and folate that signal gut absorption problems.
And sometimes you just need a tissue sample, right? Biopsies.
Exactly. Sometimes you need to see the cells themselves. Endoscopy lets the vet put a camera into the stomach and intestines and take tiny biopsies of the lining, essential for diagnosing things like IBD or lymphoma. In other cases, surgery might be needed to get larger biopsies or explore deeper tissues.
Okay, so the detective work leads to a diagnosis, finally. What's the game plan then? How do you tackle the weight loss, especially that really difficult cachexia state?
The approach hinges on two main pillars, really emphasized in the sources. Number one, treat the underlying cause. Number two, provide appropriate nutritional support. And especially with cachexia, treating that root cause is absolutely critical. Like we said, you can't just feed your way out of it.
Right, so if it's EPI,
you give pancreatic enzyme replacements with every meal. If it's hyperthyroidism, you treat that medication, surgery, radioactive iodine therapy. If it's IBD, it's often diet changes plus medications to calm the inflammation. Kidney disease needs special diets and supportive care. It's all tailored.
And alongside treating the cause, that nutritional support is vital. How's that managed? Where do you start?
First, the vet calculates the pet's basic energy needs, their resting energy requirement, or RER. But you have to be careful, especially if they're really run down.
Careful how?
You don't want to suddenly overload their system with nutrients. It can cause something called refeeding syndrome, which is dangerous big shifts in electrolytes. So you start cautiously. Maybe give just 25% of their calculated needs on day one, then slowly increase it over several days, monitoring closely.
And focusing on protein intake.
Generally, yes. Increasing protein helps rebuild that lost muscle mass. The main exception would be certain types of advanced kidney disease where protein needs to be restricted.
Okay, so how do you actually get the food into them? What are the methods?
Well, the best way is always eating normally, by mouth, if they can and will. Vets use strategies like offering really palatable, tasty foods warming it up can help release aromas. frequent small meals instead of one or two big ones, using those calorie-dense, high-protein critical care diets, or sometimes even kitten or puppy food because it's rich and tasty.
I saw omega-3 fatty acids mentioned specifically in the sources.
Yes, good point. Especially EPA and DHA, the ones
Really?
found in fish oil. They're highlighted because they have anti-inflammatory effects. Since inflammation is a key driver of cachexia, adding omega-3s can be really beneficial. They can come from specific therapeutic diets or just added as a fish oil supplement.
What happens if the pet just flat out refuses the special prescription diet that's recommended for their condition?
That's a practical reality vets face all the time. The advice is usually, getting adequate calories and nutrients from any reasonably balanced diet is better than getting inadequate amounts of the perfect therapeutic diet. Getting nutrition in is the priority when they're losing weight.
Makes sense. What about appetite stimulants? Are those used?
They can be, yes. They're used as a short-term boost to encourage voluntary eating. But importantly, they don't fix the underlying problem. Medications like mirtazapine are common, caprimorelin is another. They're used carefully, alongside treating the main issue. And the sources are clear. Forced feeding by syringe is generally not recommended. It's stressful and carries risks like aspiration.
Okay, so if they still won't eat enough, even with encouragement and maybe stimulants.
That's when assisted feeding, using feeding tubes, becomes necessary. If the gut itself is working okay, enteral feeding directly into the GI tract is preferred.
Feeding tubes. What kinds?
There are different types. Short-term ones can be placed through the nose, down into the esophagus or stomach, mainly for liquids. For longer-term feeding, tubes can be surgically placed directly into the esophagus or stomach through the side of the neck or body. These allow for thicker foods and larger volumes. In really specific cases like severe vomiting, a tube might go directly into the jejunum, part of the small intestine.
And if the gut just can't be used at all, like severe vomiting or obstruction?
Then the last resort is parenteral nutrition, feeding intravenously, bypassing the gut entirely. This is much more complex, requires intensive monitoring in a hospital setting, checking blood sugar, electrolytes constantly, and has higher risks, like infection at the catheter site or blood clots. It's reserved for really critical patients.
So tackling cachexia sounds like it really needs a multi-pronged attack.
It absolutely does. It's about controlling the primary disease as much as possible, being aggressive with tailored nutritional support, potentially using things like omega-3s to help manage inflammation, and sometimes, if the pet is stable enough, even encouraging very gentle activity to help preserve muscle function.
Okay, so treatment is started, maybe even a feeding tube is in place. How do you track progress? What's monitored?
Monitoring has to be really close. Daily body weights are essential to see the trend. Regular rechecks of both the body condition score, the fat assessment, and crucially the muscle condition score are needed to see if they're rebuilding both fat and muscle. Owners often keep detailed logs of appetite and how much food the pet is actually eating. And of course, monitoring the signs of the underlying disease is ongoing, plus repeat blood work to check organ function and ensure the primary condition is managed.
And are there risks or complications specifically with those assisted feeding methods?
Yes, there can be. With tube feeding, potential issues include vomiting or diarrhea. The tube could get blocked or dislodged, or there's a small risk of aspiration pneumonia if food ends up in the lungs. Parenteral, the IV feeding, carries those higher risks of sepsis, blood clots, and serious metabolic problems if not managed meticulously.
So finally, looking at the big picture, what does significant weight loss, especially cachexia, mean for a pet's future? What's the prognosis?
Yeah, that's the tough question, isn't it? And the answer really depends entirely on the underlying cause. If it was simple weight loss from, say, a correctable diet issue or a temporary problem, the prognosis is usually excellent once it's fixed.
But for cachexia?
For cachexia driven by advanced, irreversible chronic diseases like widespread cancer, end-stage organ failure, or really stubborn inflammatory conditions, well, the prognosis is often guarded to poor.
So in those really tough cases, does the goal of treatment change?
It often shifts, yeah. The focus becomes more about maximizing the pet's quality of life, managing symptoms, and trying to slow down the progression of the disease and that associated muscle wasting for as long as comfortably possible.
The big takeaway, though, from all the sources, is that early recognition of significant weight or muscle loss, followed by aggressive diagnostics and intervention, tackling both the cause and providing that vital nutritional support that gives pets the very best chance for a better outcome, whatever the underlying issue.
So really, owners noticing those subtle changes early, that's incredibly powerful.
It's the absolute first, most critical step in this whole complex journey we've just talked through. Bringing that concern to your vet is what kicks off the whole process. Wow. Okay, so we've really journeyed through understanding the difference between simple weight loss and the severity of cachexia. We've seen the detailed detective work vets undertake and grasped that dual approach of treating the disease while supporting the body nutritionally.
Understanding that depth really helps you appreciate what your vet is navigating when they're faced with this, doesn't it?
It really does. It makes me think, given how tightly linked chronic disease, inflammation, and metabolism are in causing cachexia in pets, what stands out for you thinking about how chronic illness impacts the body's resources generally, whether it's in our animals or even, well, ourselves?
That's a really interesting connection to draw, isn't it? Food for thought.
Well, thank you for joining us on this deep dive into understanding weight loss and cachexia in our beloved companion animals.
My pleasure. Thank you.